Hi friends, this is Dr. Anugraha here. So today's topic is atherosclerosis. Tell me, what is the definition of atherosclerosis? See, I'm sure you guys know about this, okay, because in our clinical practice and in our theory exams, we come across this word a lot of times. Atherosclerosis means it is a chronic condition. First thing, it is a chronic condition where there is inflammation, okay, where there is inflammation of what? Inflammation of the blood vessels, medium and large sized blood vessels. And eventually, after inflammation, what happens, there is going to be deposition. See, what I've drawn here is a blood vessel, and see, there is going to be deposition of lipids, smooth muscle proliferation, some immune cells over here, leading to fatty streaks accumulation inside the blood vessel. So when lipids get deposited inside the blood vessel, what happens to the lumen of the blood vessel? The lumen becomes narrow. So can blood easily flow through that narrow lumen? No, right? And eventually, what happens? There could be hardening of the vessel wall also. So this is, see, in brief, if you ask me what is atherosclerosis, I will say ഇതൊരു chronic condition ആണ്. ഏത് പാർട്ടിനെയാണ് എഫക്റ്റ് ചെയ്യുന്നത്? നമ്മുടെ ബ്ലഡ് വെസൽസിനെയാണ് എഫക്റ്റ് ചെയ്യുന്നത്. Pathology പഠിക്കുമ്പോൾ you will understand it clearly, but the definition you should know that it is a chronic inflammatory condition of the medium and the large vessels where there is lipid deposition inside the vessel. Lipid deposition, smooth muscle proliferation, some immune cells occur deposited down. So this yellow lesions get deposited inside the vessel wall, which leads to narrowing of the lumen of the vessel. അപ്പോൾ lumen of the vessel narrow ആയി എന്ത് പറ്റും? ശരിക്കും ബ്ലഡ് ഫ്ലോ ചെയ്യാൻ പറ്റുമോ ലൂമിനെ കൂടെ, ആ ബ്ലഡ് വെസലിൽ കൂടെ? ഇല്ല. അപ്പോൾ ആ ബ്ലഡ് വെസൽ സപ്ലൈ ചെയ്യുന്ന ഓർഗൻസിന് ശരിക്കും ബ്ലഡ് കിട്ടുമോ? ഇല്ല. സോ ലെറ്റ് us say ബ്രെയിനിലാണ് ഇത് സംഭവിക്കുന്നതെങ്കിൽ എന്ത് പറ്റും? ബ്രെയിനിന് ചിലപ്പം ശരിക്കും ബ്ലഡ് കിട്ടിയെന്ന് വരില്ല. Okay, so that it can lead to what? Ischemic stroke. If the same condition happens in heart, it can lead to myocardial infarction. Understood? So that is a problem with atherosclerosis. That is why we are worried about atherosclerosis, right? It can lead to serious complications. So definition understood. Now, what are the risk factors? Etiology എന്താണ്? എന്തുകൊണ്ടാണ് ആൾക്കാർക്ക് atherosclerosis ഉണ്ടാവുന്നത്? See, first thing, we have actually etiology രണ്ട് തരത്തിലുണ്ട്, രണ്ട് types ഉണ്ട്. Non-modifiable etiology nekati better word is risk factor. Okay, so we have non-modifiable risk factor and modifiable risk factor. Non-modifiable എന്ന് വെച്ചാൽ എന്താ? This is important. Okay, നിങ്ങളുടെ ഷോർട്ട് നോട്ടായിട്ട് ചോദിക്കാം in your exams, okay, college exams. So as well as in Neet also, this question has come. Simple ആണ്, it has come. So non-modifiable means നമുക്ക് ഈ ഫാക്ടേഴ്സിന് നമുക്ക് ഒന്നും ചെയ്യാൻ പറ്റത്തില്ല. ലൈക്ക് ഒരാളുടെ ഏജ് കൂടുന്തോറും the chance of him getting atherosclerosis is high. Family history of atherosclerosis, ഫാമിലിയിൽ ഈ അസുഖം ഉണ്ടെങ്കിൽ, atherosclerosis ഉണ്ടെങ്കിൽ, even the person also has high chance of getting it. Okay. Now, type A personality. Type A personality in the chendada, like people who are very much goal oriented, okay, വളരെ aggressive ആയിട്ട്, too much hardworking people, and they're a little bit anxious all the time, aggressive ആണ്, achievement oriented, they're very impatient, right? They are aggressive and stressed all the time, പിന്നെ too much workaholics. So ഇവർക്കൊക്കെ they have higher chance of getting what? Atherosclerosis. Okay, and males are more prone to get this atherosclerosis than females. All right, mostly because males, you see, one of the factor that leads to this condition is smoking. Okay, so males, if we see the census, they smoke more, right? So of course, and other factors also, that is why males have higher chance of getting this condition than females. Now, next we'll talk about modifiable risk factors. Modifiable എന്ന് വെച്ചാൽ നമുക്ക് ഈ risk factors see, if we bring a change in these factors, the chance of getting atherosclerosis is low. Okay, like diabetes. See, alku diet control well maintained on medicines ഒക്കെ ആണെങ്കിൽ atherosclerosis പെട്ടെന്ന് ആവത്തില്ല. Okay, obesity ഒരു modifiable risk factor ആണ്. ആളുടെ തടി കുറച്ചാൽ again he can live better, right? Then smoking. Smoking is really bad for health, right? Okay. So smoking, if the patient quits smoking, then less chance of getting this condition. Now the question they ask you is no. അവർ ചോദിക്കുന്നത് ഇതൊക്കെ നമുക്ക് എല്ലാവർക്കും അറിയുന്ന കാര്യമല്ലേ ഡയബറ്റീസ് ഒബസിറ്റി സ്മോക്കിംഗ് ഇതൊക്കെ മോഡിഫൈബിൾ റിസ്ക് ഫാക്ടേഴ്സ് ആണ് എവ്രി വൺ നോസ് they ask you infections. Okay, some infections they act as predisposing factors for atherosclerosis like cytomegalovirus, okay, herpes virus and chlamydia. So these infections they are risk factors. These infections vanna aalkaril they might get, see we don't know the exact reason why it causes inflammation of the blood vessels, but we have seen cases where patients who have had cytomegalovirus, herpes, chlamydia, later years they got what? Or they got atherosclerosis earlier than others. Okay, fine. Yeah, so always watch your diet. Okay, eat healthy, eat lots of fruits and vegetables, drink lots of water, be physically active. Yeah, and you should not smoke. All right, fine. Now let's move to the next one, pathogenesis. Okay, pathogenesis, why atherosclerosis occurs, guys? എന്തുകൊണ്ടാണ് fatty streaks, a lipid deposition blood vessels il ഉണ്ടാവുന്നത്? See, in one word, if your teacher asks you, okay, why does atherosclerosis occur? You will say, ma'am or sir, it is because of endothelial dysfunction. What is it? Endothelial dysfunction. I'll tell you what it means. ഇപ്പം ഞാനിവിടെ വരച്ചേക്കുന്നതാണ് നമ്മുടെ ബ്ലഡ് വെസൽ. ഓക്കെ, ബ്ലഡ് വെസൽ. ബ്ലഡ് വെസലിൻ്റെ ലൈനിങ് എന്താടാ? ബ്ലഡ് വെസലിൻ്റെ ലൈനിങ് ആണ് നമ്മുടെ എൻഡോത്തീലിയൽ സെൽസ്. എൻഡോത്തീലിയൽ സെൽസ് ഇതാ, ബ്ലഡ് വെസൽസ് are lined by endothelial cells. ഇപ്പം ഇഫ് എനി ഫാക്ടർ, ഏത് ഫാക്ടറും ആയിക്കോട്ടെ, നമ്മളിപ്പോൾ മോഡിഫൈബിൾ റിസ്ക് ഫാക്ടേഴ്സ് പഠിച്ചു, നോൺ മോഡിഫൈബിൾ റിസ്ക് ഫാക്ടേഴ്സ് പഠിച്ചു. ഏത് ഫാക്ടേഴ്സ് ആണെങ്കിലും ഈ ഫാക്ടേഴ്സ് ഒക്കെ ഉണ്ടല്ലോ, ഇവൻച്വലി ദേ വിൽ കോസ് ഈ എൻഡോത്തീലിയൽ സെൽസിൻ്റെ ഇറിറ്റേഷൻ ഉണ്ടാക്കും. സ്മോക്കിംഗ് ആയിക്കോട്ടെ, ഡയബറ്റിസ് മെലൈറ്റിസിൽ ഷുഗർ കൂടുമ്പം, ഓക്കെ, ഷുഗർ കൂടിയാലും ഈ നമ്മുടെ എൻഡോത്തീലിയൽ സെൽസിൻ്റെ ഇൻഫ്ലമേഷൻ ഉണ്ടാക്കും. ദീസ് എൻഡോത്തീലിയൽ സെൽസ് ഗെറ്റ് ഇറിറ്റേറ്റഡ്. ഓക്കെ, now when the endothelial cells of the blood vessels get irritated, over time they will undergo inflammation. What is it? avade inflammation undavunu. I'll tell the pathogenesis in a very simple way. Okay, because in some books, if you read it, they have made it too complicated. I don't like making medicine complicated. See, we should know why things occur, what is the pathogenesis, but I also believe that medicine should be made much easier, because in some books they have made it very tough. Okay, see, in simple ways what happens is നമ്മുടെ blood vessels there is endothelial dysfunction because of some risk factors. അത് സ്മോക്കിംഗ് ആവാം, ഡയബറ്റീസ് ആവാം, കുറേ ജങ്ക് ഫുഡ് കഴിക്കുന്ന സെഡൻറ്ററി ലൈഫ് സ്റ്റൈലുള്ള ആൾക്കാരിൽ their cholesterol levels are too high. അങ്ങനെയുള്ള സമയത്ത് നമ്മുടെ blood vesselsൽ endothelial injury ഉണ്ടാവുന്നു. ഓക്കെ, these factors go and irritate the endothelial cells. അവിടെ inflammation ഉണ്ടാവുന്നു. അപ്പോൾ blood vessels inflammation ഉണ്ടാവുന്നു. Now ഈ blood vessels ഒരു inflammation വന്നാണ്ടല്ലോ, see, it acts like a matrix for the lipids to come and get deposited. ഈ blood vesselsൽ, ഈ endothelial cellsൽ എവിടെയെങ്കിലും ഒരു inflammation, ഒരു injury, ഒരു instability, if they are not stable, if they are not healthy, lipids ഉണ്ടല്ലോ, ഈ ബ്ലഡിനകത്ത് ട്രാവൽ ചെയ്യുന്ന നോർമൽ ലിപ്പിഡ്സ് they get attracted to such regions and avade enga deposited out. Okay, appo the hallmark for atherosclerosis is what ennu choichal, first thing endothelial dysfunction. enna endothelial cells that line the blood vessels, adinte oru dysfunction undayal aa bhagathekku blood kuda pass cheyuna lipids endu cheyam avade chennu stuck avum, because aa anganathe irritated areas il lipids ne chennu irikkan bhayangara ishtana. Okay, appo njan ivide യെല്ലോ കളറിൽ വരച്ചിരിക്കുന്നതാണ് ലിപ്പിഡ്സ്. ഓക്കെ, ഈ ബ്ലഡിനകത്ത് നമുക്ക് ലിപ്പിഡ്സ് ഉണ്ടല്ലോ, വി ഹാവ് ലിപ്പിഡ്സ് ആൻഡ് ദേ ഗോ ആൻഡ് ഗെറ്റ് സ്റ്റക്ക് ഇൻ ദ വാൾസ് ഓഫ് ദ ബ്ലഡ് വെസൽസ്. നൗ സി, ദിസ് ഇസ് നോട്ട് നോർമൽ. ഓക്കെ, ലിപ്പിഡ്സ് ഗെറ്റിംഗ് സ്റ്റക്ക് ഇൻ ദ ബ്ലഡ് വെസൽസ് അത് നോർമൽ അല്ല. അപ്പം നമ്മുടെ ബോഡിയിൽ ഇങ്ങനെ ഒരു ആക്ഷൻ നടക്കുമ്പോൾ our immune system gets activated. എന്താണ്? I can't choose a different color. 1 minute. So, see, once this occurs, no, our immune system gets activated and immune system will send its fighters. Immune system വിചാരിക്കും, see, ഏതെങ്കിലും ഒരു ബ്ലഡ് വെസൽ, ഇപ്പോൾ അബ്ഡോമൻ ലയോട്ടയാണ് ഞാനൊരു എക്സാമ്പിളായിട്ട് എടുത്തേക്കെന്ന് വെച്ചു. അപ്പോൾ അബ്ഡോമൻ ലയോട്ട അല്ലെങ്കിൽ കൊറോണറി ആർട്ടറീസിൽ ലിപ്പിഡ്സ് എന്നിങ്ങനെ ഡെപ്പോസിറ്റഡ് ആയി ഇരിക്കുകയാണ്. അപ്പോൾ നമ്മുടെ ഇമ്മ്യൂൺ സിസ്റ്റം ഗെറ്റ്സ് ആക്ടിവേറ്റഡ് and immune system thinks that there is some problem with the blood vessel, and those immune system വിചാരിക്കുന്ന ഏതോ ഒരു ഫോറിൻ ബോഡി അവിടെ ഒന്ന് ഇരിക്കുന്നതാണ്, മേ ബി വൈറസ് ഓ ബാക്ടീരിയ, ഒരു ഫോറിൻ ബോഡി. സോ അങ്ങനെ ഉണ്ടെങ്കിൽ നമ്മുടെ ഇമ്മ്യൂൺ സിസ്റ്റം എന്താ ചെയ്യുക, അതിനെ വന്ന് ക്ലിയർ ചെയ്യാൻ നോക്കും അല്ലേ. അപ്പോൾ ഇമ്മ്യൂൺ സിസ്റ്റം thinks that the blood vessels are attacked by a foreign body and it will send its cleaners. നമ്മുടെ ഇമ്മ്യൂൺ സിസ്റ്റത്തിന്റെ ക്ലീനേഴ്സിനെയാണ് മാക്രോഫാജസ് എന്ന് പറയാം. മാക്രോഫാജസിനെ ഈ ഏരിയയിലേക്ക് വിടും. ഓക്കെ, മാക്രോഫാജസിനെ ഈ ഏരിയയിലേക്ക് വിടും, ലിപ്പിഡ്സ് അറ്റാച്ച്ഡ് ആയിട്ടുള്ള ഏരിയയിലേക്ക് വിടും. ഈ മാക്രോഫാജസ് എന്നിട്ട് എന്ത് ചെയ്യുമെന്ന് അറിയോ? These macrophages will go and engulf the lipids. Okay, they will go and engulf the lipids. Right? They eat the lipids. Macrophages വളരെ hungry ആണ്. Okay, they will go and eat the lipids stuck upon the vessel walls. അപ്പോൾ see, let me just draw. Let us say this is a macrophage and inside എന്തുണ്ടടാ, lipids ഉണ്ട്. Okay, അപ്പോൾ ഈ whole picture that you see here, the whole picture that you see here, this one second, that whole picture is called as a form cell. And the form cell that is inside the macrophage, lipids ഉണ്ടെങ്കിൽ ആ ഒരു പിക്ചറിനെയാണ് നമ്മൾ form cells എന്ന് പറയുക. Okay, fine. Now, see, when I say lipids, you should know what lipids in the deposit ആവുമെന്നാണ് ഞാൻ പറഞ്ഞത്. See, to dig a little deeper into the pathogenesis, ഈ lipids എങ്ങനെയാണ് നമ്മുടെ blood vessels വരിക? See, when I say lipids, I mean to say LDL. What is LDL? LDL, low density lipoprotein. എന്താണ്? Low density lipoprotein ആണ്. That's what I mean when I say lipids. I'll tell you how it reaches the blood vessel. Okay, let me just draw a liver here. Okay, liver, it synthesizes triglycerides, okay, and it synthesizes cholesterol. നമ്മുടെ liver normally it synthesizes, in you and me it synthesizes triglycerides, cholesterol. ഈ രണ്ട് കോമ്പണൻസും നമ്മുടെ ബോഡിക്ക് അത്യാവശ്യമായിട്ടുള്ളതാണ്. ട്രൈഗ്ലിസറൈഡ്സ് നമ്മുടെ ടിഷ്യൂസിന് എനർജി കൊടുക്കുന്നു. See, cholesterol, in normal amounts, okay, cholesterol is very much needed for what? നമ്മുടെ സെൽ മെംബ്രെയിൻ ഇല്ലേ, നമ്മുടെ എല്ലാ സെൽസിൻ്റെയും മെംബ്രെയിൻ ഫോർമേഷൻ സ്ട്രെങ്തിന് ഇമ്പോർട്ടൻ്റ് ആണ്. പിന്നെ steroid hormone production like cortisol, sex hormones in the production, you need this cholesterol, right? So normal levels of triglycerides and cholesterol നമ്മുടെ ബോഡിക്ക് ആവശ്യമാണ്. ഓക്കെ, അത് നമ്മുടെ ലിവർ ഓൺ ആയിട്ട് സിന്തസൈസ് ചെയ്യുന്നുണ്ട്. Okay, and also from our diet we get triglycerides and cholesterol. Now see, the triglycerides and cholesterol form from the liver. Okay, they are packed in a box. They are what? Packed in a box called as VLDL. എന്താണ് VLDL? നമ്മുടെ ലിവർ സിന്തസൈസ് ചെയ്യുന്ന ട്രൈഗ്ലിസറൈഡ്സ് ആൻഡ് കൊളസ്ട്രോൾ ലിവർ എന്ത് ചെയ്യും? ഒരു ബോക്സിൽ പാക്ക് ചെയ്യും. ആ ബോക്സിനെയാണ് VLDL എന്ന് നമ്മൾ പറയാം, വെരി ലോ ഡെൻസിറ്റി ലൈപ്പോപ്രോട്ടീൻ. ഈ VLDL is released into the bloodstream. ഈ VLDL molecule എന്താണ്? It is released into the bloodstream. Okay, ഇതുവരെ നോർമൽ ആണ്. It happens in all of us. Okay. Now this VLDL, as it moves through the bloodstream, it will release the triglycerides. Okay, triglycerides will go to our tissues. It will go to the fat storing areas of the body. So basically triglycerides, as I mentioned, our body needs triglycerides for energy production. For energy. So okay, VLDL ഈ പാക്കേജിൽ നിന്ന് ട്രൈഗ്ലിസറൈഡ്സിനെ റിലീസ് ചെയ്തുകൊണ്ടിരിക്കും in the blood vessel. Okay, and it goes to different parts of the body. Also, VLDL in a little bit of cholesterol also moves out. Okay, and that goes and does its work. Cholesterol also has work. I told you it helps in cell membrane formation of the body. It helps in hormone production. Okay, now inside this VLDL packet, the leftover cholesterol, what is it? The leftover cholesterol, that is called as LDL. What is it? That is called as LDL. You understood what is LDL? Once again, listen carefully. Liver, it synthesizes its own triglycerides, cholesterol, that is normal. Our body needs both the molecules. It synthesizes and packs it in a package, in a gift box called as VLDL, very low density lipoprotein. Then this VLDL is moved into the bloodstream. Okay, as it travels through the bloodstream, VLDL releases triglycerides. It goes to our tissues. It goes to the muscles because we need energy. It goes to the fat storing areas. Then VLDL also releases cholesterol into the bloodstream. VLDL is traveling in the bloodstream. So from this package, the cholesterol is also released out. Now inside that VLDL, the leftover cholesterol, that is called as LDL. Understood? That is called as LDL. Now in people who eat a lot of junk food, okay, in people who have lot of cholesterol, there is going to be lot of LDL. And remember, LDL is bad cholesterol. Okay, so this LDL is the one, okay, that gets deposited into the vessel wall. Understood? So when I said lipids, okay, these fatty lesions get deposited, or fatty substances get deposited in the vessel wall, I meant to say LDL, low density protein. That is a molecule that you see here, yellow in color. That is LDL. Understood? Now when LDL is getting deposited in the vessel wall, what happens? Our immune system thinks, there is some foreign body sitting on the blood vessel, let me go and clean it up, let me go and eat it or clear that area, right? So it sends the macrophages, their immune cells, and the macrophages will go, okay, and cover the LDL molecules, and that is called as sperm cells. Okay, when the macrophages engulf the LDL molecules, that whole picture, those cells are called as sperm cells. Understood? Now, because of all these reactions happening, there is going to be further inflammation of the blood vessels. Okay, now see, when the blood vessels get inflamed, you know what happens? Our body thinks, okay, the blood vessel is getting inflamed. It is there is a chance for a rupture of that blood vessel. So let me do one thing. Let me just send my platelets to that area, so that in case there is rupture of blood vessel, in case there is slight bleeding occurring from those regions where there is inflammation in the blood vessel, I can clot there, right? There won't be so much bleeding. So what the body does, it sends its platelets to those areas of the blood vessel where there is inflammation. Okay, now over time, I told you this condition is very chronic, right? So lot of platelets might get deposited in those inflamed areas of the blood vessels. So those areas, what happens when lot of platelets get deposited? What is formed here? A clot is formed. Understood? A clot is formed in those inflamed areas of the blood vessel. Now, tell me, if the clot keeps on increasing in size, won't it block the artery? Won't it block the artery? Yes. So that is what we are worried about. Thrombus formation. The thrombus, it can block the artery and it can decrease the blood supply to the specific organ. Suppose, see, if there is atheromatous plaques forming in the carotid arteries, it can cause what? Stroke, because the blood will not be reaching brain so well. If the atheromatous plaques are formed so much in the coronary arteries, heart will not be getting enough of blood, right? It can lead to MI. Understood? Okay. So this is in brief and in very simple way that I can explain atherosclerosis. Okay, now, see, they won't ask you, in competitive exams, they don't ask you this. They ask you all the mugging up part only. Okay. Hey, one more thing. See, in blood vessels, you know that blood vessels, they have 3 layers, right? The innermost layer, they go, okay? The innermost layer is called as what, dear? Tunica intima. The middle layer is called as tunica media. And the outermost layer is called as tunica adventitia. Now, why I told you this is because, see, they'll ask you, where is the fatty streak getting deposited? Is it under tunica adventitia? Is it above tunica media? Or where is it? So the answer is, it is the fatty streaks are deposited subintimal. Okay, let me just take yellow color. It is subintimal, means just below the tunica intima, right? Just below the tunica intima, the fatty streaks are deposited. So the question that comes in your competitive exams, tell me the site of fatty streak deposition in atherosclerosis. That is subintimal, just see below the intima, tunica intima, subintimal. Okay, one second. Yeah. So let's go to the next slide. Yes, okay. The next question they ask you is, what is the first lesion that you see in atherosclerosis? The first visible lesion that you see in atherosclerosis is fatty streak. Very, very important. That yellowish streak that appears first on the blood vessels. The initial lesion that you see in atherosclerosis, that is called as fatty streak. And the site is where, guys? Subintimal, just below the intima. Okay. Okay, that's understood. Okay. Now, as the fatty streak progresses, it becomes much bigger, and now we call it as an atherosclerotic plaque. What is it? Atherosclerotic plaque. Now, this plaque has got 3 parts. At least learn the names of these 3 parts. What these 3 parts contain, if you can remember, well and good, but at least you should know what are the 3 parts of atherosclerotic plaque. Look here. Let me just take the next. Yeah, see. What you see here, okay, this part is a blood vessel, okay, and this part that you see, that is a lipid deposition, okay, atherosclerotic plaque. It has got 3 areas, dear. It has got the first part that is called as a fibrous cap. One second. Okay, so this is a plaque, and see the top part that you see is called as a fibrous cap. The yellow part that you see is called as a lipid core, okay, and the edge, this part, the edge, the part of the plaque that touches the blood vessel, okay, this is called, can you see, I don't know if you can see properly, this side, okay, these sides, these are called as shoulder of the plaque. Just a moment, I'm having allergy. Yeah, guys. Where did I stop? Yeah, so 3 parts you learned. It has got, the plaques, they have a fibrous cap, okay, the edge of those plaques, it's called as a shoulder, and the inside part, that is a lipid core. 3 parts you understood. See, the fibrous cap, it consists of smooth muscles and collagen. The shoulder, it is the edge of the plaque, and the shoulder has got T cells, immune cells, and the lipid core has got cholesterol. Okay, at least learn the names. Now, see, we learned about these 3 parts to know what is a stable plaque and an unstable plaque. See, first I'll tell you what you mean by these 2 terms, then I'll tell you the significance. When I call a plaque as stable, okay, it means it has got a thick cap. Where is that? See, if see the above part, look here. If, okay, the plaque has got a thick fibrous cap, then I call it stable, okay, because see, if it has got a thick covering, thick fibrous cap, the chance of this atheromatous plaque getting ruptured is less, okay. So why do I fear a rupture of this plaque? See, when atheromatous plaques rupture, it will release the lipids, the cholesterol, right, the inflammatory cells into the bloodstream. It can further damage the blood vessel wall and cause platelet aggregation. It can increase the thrombus formation, clot formation, okay. So that is why, an unstable plaque should be feared. So see, a stable plaque means the fibrous cap is very thick, okay. Now, When I say unstable plaque, it means it has got a thin cap, okay, and a large lipid core. Now, the problem with thin cap is there is chance for atheromatous plaques getting ruptured. It can further worsen the condition. It can cause more platelet plug formation there, thrombus formation there, and yeah, occlusion of the artery. So, unstable plaques, they are dangerous. Understood? All right, and a little high-end knowledge here. Yeah, there is something called as KLF2 gene, crupple-like factor 2 gene. Now, see, this gene is present in all of us, and if it's good enough in a person, they say that, recent studies have shown that it is very protective against atherosclerosis. All right. So yeah, just read the name once, that would do the job. It might come in your higher competitive exams. KLF2 gene, yeah, this gene is protective against atherosclerosis. Understood? Now, just see the picture here. These are form cells, okay? These are form cells that you see in atherosclerotic plaques. And see here another picture of a blood vessel having atherosclerosis. See here, what you see here in these white areas, okay, these white areas are the regions where there was lipid deposition. See, when we do biopsy, okay, when we stain it, during those procedures, we use formalin, alcohol, so the lipid content gets dissolved. Okay, so those areas wherever lipid was deposited in the vessel wall, those areas will look white in color. Okay, so you can see white color here. So it means that in normal blood vessel, actually there were lipids deposited here. Okay, so yeah, these are called as cholesterol clefts that we see in atherosclerosis. Okay, now the complications, just for completion's sake, I have added it. Complications of atherosclerosis: aneurysm, that is, permanent dilatation of the blood vessel, that is aneurysm. There could be calcification, thrombosis, ulceration. Let's do some questions. Which of the following is the earliest histological change seen in atherosclerosis? What is the first visible change or lesion that you see in atherosclerosis, guys? I just told you that is a fatty streak. That is the first visible lesion that you see. Okay, fatty streak. It's a PYQ. Next question. Which of the following best describes a vulnerable plaque? Vulnerable means unstable plaque. It can cause problem anytime if it ruptures. You tell me, see, a plaque with, answer is 3, okay? A plaque with thin fibrous cap and rich lipid core. Well, this plaque has to be feared. If it ruptures, problem. Okay. Next question. Which of the following artery is least likely to be affected by atherosclerosis? This I haven't told you. See, the most common artery that is involved in atherosclerosis, that is abdominal aorta, and the least one is pulmonary artery. Okay. Pulmonary artery. Alright, next question. Which lipoprotein is most strongly associated with atherosclerosis? Which one is it? HDL, VLDL? Which one, guys? Yes, it is LDL. LDL. Even if you didn't understand the pathogenesis of atherosclerosis, but I really hope you understood. Yeah. You should know, in atherosclerosis, who is the villain? Yeah, it is LDL. LDL. Okay. Now, some get confused between, okay, so that's all about atherosclerosis. Okay. So, guys, some get confused about which is good cholesterol, which is bad cholesterol. Okay, so you have something called as LDL and HDL. See, I told you LDL is a problematic one causing atherosclerosis and all complications. So LDL is bad cholesterol. HDL is actually good cholesterol. HDL is good cholesterol. How will you memorize it? Here HDL, H stands for, remember, healthy. H stands for what? Healthy. So HDL is good cholesterol, LDL is bad cholesterol. I think I'm done with the slides, yeah. So I'll see you in the next class. Please give me your feedback. Take care, stay healthy, drink lots of water and stay happy. Bye-bye.